Arun? Right. Right.
Itrana, am I audible? Yes, ma. Okay, ma'am.
Let me check in the YouTube.
Yes, yes. Yeah, I also can check.
It's coming in YouTube. Only thing, there is a little delay.
Delay. Okay. Yeah, there
Yeah,
will be delay. That is
there
expected.
will be. Yeah, yeah. So I'll put my mic off.
Okay.
It'll come. It'll come in. Uh,
Few seconds, I think.
see, మనది వస్తుంది ఇప్పుడు. ఈ delay.
Oh,
నా మైక్ ఆన్ ఉంది కదా, అది రిపీట్
yeah.
అవుతుంది.
Let's check if doctor.
Brother, she's joining. Just give her 2 minutes.
Sure, sister. Good evening, dear school leaders. Welcome to ACSI South Asia's Professional Development Webinar. Thank you for joining today's important webinar on essential first aid skills. As educators, we hold the responsibility of not only imparting knowledge, but also ensuring the safety and well-being of our students. Knowing how to handle medical emergencies effectively is crucial in creating a safe learning environment. Today's session will equip you with practical skills that could make a difference in critical moments. Please take notes and feel free to ask any questions during the Q&A session at the end. We are honored to have an experienced medical professional with us to lead this session. It is my pleasure to introduce our distinguished speaker, Dr. P. Mary Vijaya. She completed her MBBS at Gandhi Medical College, Hyderabad, India, and pursued her postgraduate DNB in family medicine at Christian Fellowship Hospital in Odanchatram, Tamil Nadu, India. Dr. Vijaya is married to Dr. Dheeraj, a hand surgeon, and they are blessed with 2 children, Ivana and Emmanuel. Driven by a passion for serving in mission hospitals, upholding ethical medical practice, she followed God's leading and is now part of the Unicorpus Health Foundation. So we are privileged to have her share her expertise with us today. That said, let's welcome Dr. Mary Vijay. Thank you so much, ma'am, for accepting our invitation. We school leaders from India, Pakistan, and Sri Lanka are all eager to learn from you. Over to you, ma'am, Dr. Vijaya.
Thank you, sir.
You're welcome. Thank you too.
Good evening, everyone. First of all, I would like to thank ACCI for giving me this opportunity. So my topic is
Brother Peter, would you make Dr. Vijaya the co-host, please? Ma'am is trying to share a presentation.
here is my topic. It's essential first aid skills for schools. Before going into the topic, I would like to give some introduction about the first aid. The term first aid was introduced in 1878 and is a combination of first treatment and national aid. In return, civilian ambulance crews were trained specifically for railways, mines, and police about the first treatment. Yeah. Coming to the definition, first aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury. Aims of the first aid are to preserve life, to prevent the injury from worsening, to promote recovery, and to protect the unconscious individual. Principles of the first aid are we need to take the immediate action, and we need to calm down the situation, call for medical assistance in case of any emergencies, and apply the relevant treatment needed. Then first aid kit. This is the first aid kit. It should contain antiseptic pads, band-aids, cotton balls, elastic bandages, hot and cold packs, soap and hand sanitizers, plasters of different sizes, disposable sterile gloves, thread bandages, and small, medium, large sterile dressings. You can see here in the picture. This is the elastic bandage and emergency blankets, then antiseptic wipes, safety pins, tapes, gloves. First aid should contain all these things. Then primary assessment. Primary assessment, in case of any emergency or if the child is unconscious, first we have to evaluate the child by doing this primary assessment. Primary assessment is a quick evaluation of a patient's condition to determine life-threatening issues and how to treat them. It is also known as primary survey and is often performed using this mnemonic doctors ABC. We call it as doctors ABC. Here, D stands for danger, R for response, S for send for help, A for airway, B for breathing, and C for circulation. Coming to the danger, we have to check for danger, whether the situation or the area is dangerous to you, or whether it is dangerous to other children or to the casualty. In case of any emergency or dangerous area like fire accidents, we have to shift the casualty immediately to an area of safety. Then we have to check the response. Response of the child can be checked by talk and touch approach and also COWS method. Here it's in this C stands for, we can ask the child, these questions. Can you hear me? Open your eyes. What is your name? Squeeze my hands. Like this we can ask to check the response of the child. If there is no response, we can do the things like rubbing of palms or soles of the child. Sometimes it may elicit a response. If no response is there, immediately we should call for medical assistance. Then airway. Airway actually is a passage of air in and out of the lungs. So patent airway is usually maintained by tilting the person's head. Here you can see in this picture, tilting the person's head back at 45 degrees angle and lift their chin. This is called the head tilt and chin lift maneuver. So, and also we have to check the airway, whether it is open and clear of obstructions. Usually the obstructions are blood or vomit or any other foreign material, especially in case of children. Next, breathing. Breathing can be checked by look, listen, and feel for up to 10 seconds. We have to look for rise and fall of the chest and listen for breath sounds or air arising from the nose or mouth and feel the breath against your face. If not breathing and the child has a patent airway, rescue breathing should be commenced. I will explain you later about what is this rescue breathing. Then circulation. Circulation is nothing but it's a continuous movement of blood throughout the body driven by the pumping action of the heart. We can check the circulation by three things. We can check for color and check the temperature and check for capillary refill time. Color can be checked by looking at the child's hands and fingers. They should be pink and not blue or pale. And temperature can be checked by feel the child's hands to see if they're cool or warm. And capillary, next is the capillary refill time. So in this, we have to, press the tip of the finger or toe. That area should turn pink within 3 seconds or less. If it takes more than 3 seconds, then for the child, circulation is not maintained properly. In case of an injured hand or leg, you have to check for sensation or movement. Now we have come to the main topic, CPR. It means cardiopulmonary resuscitation. First, as I told you before, we should do the primary assessment by following the mnemonic doctors ABC. And then we should recognize whether there is need for CPR or not. If there is a need for CPR, it should be commenced immediately if the child is unresponsive or if the child is not breathing normally or not showing any signs of life. CPR means cardiopulmonary resuscitation. It includes chest compressions and rescue breathing. So, chest compressions, way to do. Chest compressions are done near the midline or center of the chest, lower half of the sternum. Here, you can see in this picture, this is the breastbone, or we call it as sternum. We can use nipples as landmarks to guide where should be doing your compressions. Chest compressions are performed between the nipples. Then how to do? We have to push hard and fast with straight arms. We have to use the heel of both hands with one position on top of the other. Compress 1/3 depth of the chest wall, approximately 5 centimeters in the center of the chest. It is followed by 2 rescue breaths. 30 compressions plus 2 rescue breaths is equal to 1 cycle. We have to do 5 cycles of total in 2 minutes. And we have to recheck the signs of life at the end of the cycle. Pause compressions to allow for rescue breaths. We should not interrupt CPR chest compressions in between. Here, I'm going to show you the video for better understanding.
Hello. In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step, D.
This is a video. Then coming to secondary assessment. Once the primary assessment got over, we need to do the secondary assessment. In secondary assessment, we have to do the head-to-toe examination. Means from head to toe, we have to examine the child. We have to examine the head, whether there is any injuries or any lacerations, any bleeding, and we have to check the neck, whether there is any fractures. And we need to check the chest also, chest, abdominal region, like that, hips, legs, hand, back, everything we need to check. Then these are some common injuries and first aid tips. First thing is cuts and scrapes. So in this, we have to arrest the bleeding by applying some pressure, followed by run the wound under water. Then apply antiseptic cream and cover the area with a bandage. Take the child for a tetanus injection if not received in the last 10 years. Next, minor head injuries. When we call it as minor head injury means if the child does not have any vomiting or ear bleed, nose bleed, or any bleeding from the mouth, vomiting, headache, if these are not there, then we call it as a minor head injury, or if the child is conscious. In case of minor head injuries, we have to make the child to relax or sit down. Then you have to apply cold compress to the injured area. And as I told you now, we have to check for danger signs. Danger signs means we have to check for any ear bleeding, nose bleeding, any vomiting, headache, seizure, drowsiness, loss of consciousness, everything we need to check. These are the danger signs. If danger signs are there, immediately we have to shift the child to the hospital, call for an ambulance. In case of any open wound, we have to do the dressing. Then coming to the minor burns. In case of minor burns, immediately put the burnt area under running water for approximately 5 minutes. Followed by, then we have to apply silver sulfadizine cream or Bernol, whatever you have. But don't put cool water or ice over the burnt area. Coming to the nosebleeds. Nosebleeds. Actually, most commonly, we will see this condition in children. In case of nosebleeds, we have to sit the child down and lean forward. Pinch the soft part of the nose and breathe through the mouth. Release the pinch after 10 minutes and repeat if bleeding persists. Do not remove any clot or blow the nose or insert any object into the nose. Here in this picture, you can see. Like this, we can pinch. Tilt forward. Don't tilt backwards. Next, this is also most common in schools. Sprains and strains. What is sprain and what is strain? Sprain is a soft tissue injury that occurs when a ligament in a joint is stretched too far or torn. It is a ligament injury. Strain means it's a muscle injury. It's like pulling. It's due to pulling of muscle. Strains will occur. In case of sprains and strains, we have to follow this method, RICE method. RICE means RIC. Here, R stands for rest. So we have to give rest to the injured part, followed by ice. Compress with ice. Then C for compression. Compression with crepe bandage. Apply comfortable support. E stands for elevation. elevate the injured part to minimize the swelling. Next, come to the fracture. Fracture can be identified if there is any signs like swelling, difficulty in moving, loss of strength, or a limb that looks shorter, twisted, or bent. In case of open fracture, or if there is any open wound, we have to first cover the wound with sterile dressing. Then apply pressure to control bleeding. Then most important thing is we have to support that part, fractured part, to prevent movement. Because if there is any movement, it might cause injury to the surrounding blood vessels and there will be delayed healing. Immediately, we should shift the patient to the hospital. Next, fainting. Fainting is a temporary loss of consciousness from a sudden decrease of blood flow to the brain. It usually lasts seconds to minutes. In this case, first we have to make the person safe by laying the person flat on his or her back. Then elevate the person's legs to restore blood flow to the brain. If there is any tight clothing, we need to lose that. Then we have to revive the person. We have to shake the person vigorously, tap briskly, or yell. If the person does not respond, call emergency services immediately and start CPR if necessary. As I told you before, in this thing, we have to do the primary assessment and secondary assessment. In case of primary assessment, after doing primary assessment, the child does not show any signs of life, does not breathing or unconscious. Immediately, we need to do the CPR. Then medical emergencies. Here, it's a case scenario. You can answer for yourself. Sunny, a 7-year-old, while eating food, developed difficulty in breathing, cough. He clutched his throat and was unable to talk. What might be the reason? How will you treat? I'm giving you 1 minute time. You can answer for yourself.
Choking.
Yeah, correct. It's choking. Choking is due to the upper airway obstruction. Airway means, as I told you before, it's a passageway for air to move in and out of the lungs. It includes nose, throat, larynx, means its voice box, and lungs. In case of partial obstruction, we'll see wheezing, means noisy breathing, difficulty breathing, cough. But in case of total obstruction, the child was, unable to talk, breathe. He clutches his throat, and there might be loss of consciousness also. How to manage? In case of choking, we have to encourage the child to cough and also position the child leaning forward. We have to give back slaps between the shoulders in an upward motion. You can see in this picture. I'll show you video also for better understanding. If unsuccessful chest thrust or tummy thrust, or the patient is unconscious, we have to commence CPR. Here is a video for you.
Please remember at this time you should avoid putting your face near to the mouth and nose of a casualty. This video will demonstrate first aid steps to help a casualty who is choking. If you suspect that someone is choking, then the first step is to ask them, "Are you choking?" It's important to confirm that this is what's happening. If the casualty is breathing, then encourage the casualty to cough. The coughing action can help dislodge any food or item that is blocking the casualty's airway. If coughing has not helped and the casualty cannot speak, stops coughing or breathing, then you should give them up to 5 back blows. Use the heel of your hand between their shoulder blades. Remember to check after each blow to see if the obstruction has been cleared. If the back blows fails to clear the obstruction, then you should give up to 5 tummy thrusts, abdominal thrusts. Stand behind the casualty and place both arms around the upper part of their abdomen. Make sure they're leaning forward. Clench your fists and place it between the navel and the bottom of the breastbone. Grasp your fist firmly with the other hand. Pull sharply inwards and upwards up to 5 times. Check the casualty's mouth. If the casualty is still choking, then it's a life-threatening situation and you need to call 999 or 112 for emergency help. Repeat step 3 and 4, rechecking the mouth after each step. Do this until help arrives or the casualty becomes unresponsive. Remember, your casualty's condition could possibly get worse and they could even become unresponsive. If this happens, then be prepared to use basic life support and start CPR.
So next, one more case scenario. Navina, a 10-year-old girl, fell from the first floor accidentally and became unconscious. She also had bleeding from the nose and ears. What is this condition and how will you manage?
You can type in the chat or you can unmute and say it loud.
As I told you before, it is a severe head injury. In case of any vomiting, ear bleeding, nose bleeding, or bleeding from the throat, if there is any loss of consciousness or seizures, we call it as severe head injury. Immediately, we have to do the primary assessment. As I told you before, doctors ABC. We need to do that. If there is no response.
Dr. Reverend Dave mentioned on chat, suspect spinal injury.
Spinal injury. No. Spinal injury might be there, but if you suspect any spinal injury or neck spine injury or back spine injury, in case of neck spine injury, we should not move the child until the emergency team comes. This is main thing we should do. But in case of spine injury, usually the child, he couldn't move his limbs. In case of neck spine injury or cervical spine injury, the child couldn't move all the 4 limbs, means he couldn't move hands and legs. In case of, lumbar spine, lower spine injuries, he couldn't move the legs. By this, we can know it might be spinal injury. So in case of this, we have to do CPR and also we have to shift the patient immediately to the hospital and call for an ambulance. One more case scenario. Joshua, 10-year-old, while playing outside in the ground during winter season, developed difficulty in breathing, cough, and unable to speak. What might be the cause? How will you treat?
There's a response on chat, Doctor. Wheezing. They mentioned here 2 responses mentioned as wheezing.
Yeah, wheezing. Wheezing is a symptom. We call it as asthma exacerbation. Wheezing is a symptom of asthma. Actually, it's due to the airway narrowing. Because in this question, I mentioned during winter season. Some children are usually asthmatic. So in these children, we have to prevent some triggers. The common triggers are smoke, exercise, cold, pollen, dust, animal fur, and changes of the weather. So if the child is a known asthmatic, he should avoid all these triggers. So in this case, child complains of cough, difficulty in breathing, wheeze, noisy breathing, unable to speak. So in schools, known asthmatic children, we should encourage the child to carry their relievers. Usually, children, they used to, have relievers with them. So we encourage them to carry with them to the school. How will you manage asthma exacerbation? In this case, we have to position the child upright, slightly leaning forwards, and we have to monitor the child. First, we have to give reassurance and assist the child with their reliever medication. So it is very important. In case of non-asthmatic children, nowadays, most of the schools, they are taking medical history before joining into the school. So we have to, educate the parents to carry the reliever medication with them. And immediately we have to ship the child to the hospital. Next question. Blessy, 7-year-old, while playing in the ground, developed a rash over the skin, watery eyes, swelling over the face and lips. What might be the reason and how will you manage?
There's a response on chat, ma'am. Bee stings. Insect sting.
Good. It is an allergic reaction
Allergy.
to insect bite and sting bite. So some children are usually allergic to some food or insect bite or stings, dust mite and latex. So in this case, child may complain of sneezing, running or itching nose, watery eyes, sometimes abdominal pain, vomiting and skin itching. In case of severe reactions, child may develop swelling over the face, lips, tongue, breathing difficulty, and swelling over the eyes and throat also. So in these scenarios, we can keep some tablets, our syrup, citrizens tablets or syrups, we can keep in the schools. If there is any need, we have to give them. And also, calamine lotions. In case of skin rash, we can apply calamine lotion over the skin. And immediately we have to ship the children to the hospital. Next. Chinnu, 4-year-old, has a high fever, developed seizures. How will you manage? This I will tell. This is nothing but we call it as febrile seizures. Means sometimes children up to 5 years old, they develop seizures. There is high temperatures. So in case of high fever, head injury, vomiting, diarrhea, children might develop seizures. Seizures are nothing but tonic-clonic movements of hands and legs. There might be frothing or involuntary passage of urine or stools. There might be uprolling of eyeballs and bluish discoloration around the mouth. So in this case, how will we manage? First of all, when we see any child like this condition, mostly we will panic. But thing we shouldn't do is don't panic and try to remain calm and reassuring. Then keeping them safe. If they are falling, help them to the ground. If they are near a busy road or hot pepper, move them to safety and remove any nearby objects. And most important thing is, in this case, we have to protect the airway by gently turn them onto their side with their mouth facing down. This keeps their airway clear. Because in these cases, most common cause of obstruction is tongue. Because actually they are unconscious. So tongue will automatically, it falls backwards. So to prevent this, we have to turn them onto their side with their mouth facing down. Next thing is loosening tight clothing. So we have to take off their eyeglasses and loosen anything around their neck that could block breathing. And we have to monitor the seizure and time the seizure to see if it lasts more than 5 minutes. If it does, seek immediate medical attention. And once the seizure ends also, stay with them and talk to them calmly until they recover. Wipe away any excess saliva to help them breathe more easily. And check their mouth to make sure nothing is blocking their airway. If they're having difficulty breathing, and call an ambulance, and we have to ship the child to the hospital. Next. These are the golden rules of first aid. Do first things first, quickly, quietly, and without fuss or panic. And give artificial respiration. Breathing has stopped. Every second counts. And as I told you before, we should stop any bleeding by giving compressions or pressure. And guard against or treat for shock by moving the casualty as little as possible and handling them gently. Do not attend too much to the minimum. That is essential to save life and prevent the condition from worsening. And reassure the casualty and those around, and so help to lessen anxiety. Do not allow people to crowd around as fresh air is essential. This is very important. Do not remove clothes unnecessarily. Arrange for the removal of the casualty to the care of a doctor or hospital as soon as possible. Thank you.
Thank you so much, ma'am, for enlightening us with essential first aid skills in schools. Thank you for your time and thank you for your expertise. Now, I think there are some questions. If you can unmute and ask your questions or type your questions online. Forgive me for the bad lighting. We are in Sri Lanka. I'm just sitting in a restaurant and trying to host the webinar. Yeah, you can unmute or type your questions on chat. While you are thinking, I would ask one question to Dr. Vijaya. Ma'am, what you said is very clear. Yeah, is very clear and very informative. So, do you suggest schools to encourage their teachers get trained in first aid? And are there any institutions that train on first aid in India or any South Asian country?
Yeah, definitely. Every teacher should know about first aid skills. But I heard some training centers are there, but I am not sure. I'll chat you later about it.
Sure, ma'am. I personally heard about Christian Medical College in Vellore having a 3-day first aid training for schools in India, or schools from Sri Lanka can fly down there. If they can fly down their teachers there, it will be a good thing. Yeah, sure, ma'am. We'll wait for your input on that as well. There is something on the chat. Let me read it. Reverend Dave says, thank you, doctor. Lovely session, very interesting and informative. Thank you, Reverend Dave. And Nadisha says, thank you so much. Very clear and very useful. Dilanti Manuel from Sri Lanka. Dear ma'am says, thank you, doctor. All right. Okay. Many thank yous coming from Sri Lanka and India. Yomal from Ethos International. Pushpa Murugaya. Thank you. And Rehmat Isaac from Pakistan. Wonderful session. Great. Thank you for acknowledging the doctor's session, Sukanya, ma'am, and Bridget Christine. Any questions you have? Any questions? Ashang, thank you, ma'am. Very informative. Mary Lou, ma'am, from USA. Thank you. Horizon School, Charagonda, thank you.